So here's an introduction to the cases that we're going to do in the EMT course. We will give you several different cases to work through, and with each of them, we'll give you some information about the system in which you're working. We'll talk about the time of day and the day of the year. We usually just use whatever day it is, although in some cases, seasonal things would matter, or the time of the day would matter. And if that's the case, we'll point that out. We'll give you your response time to the scene and then your transport time. And we'll usually use a local small community hospital, and then we'll also sometimes use a full service specialty center, usually a trauma center. And we'll explain what your role will be. Frequently it will be first responding, non-transporting, but then we'll progress into where you're a transporting BLS unit. This gives you a chance to work through all the various roles that you might fill. We'll give you some dispatch information, including the nature of the call and then the predicted acuity using the standard medical priority dispatch system, acuity levels going from lowest more or less linearly toward highest predicted acuity. Then we'll give you the location, address, and cross streets, give you a chance to work on finding locations and finding your route. We'll talk about whether you're going to use lights and siren or not, and again talk about your route to the scene and some implications for whether you enter the scene immediately or if you stage. We'll give you scene information, what you see, what you hear, who else is there, what they tell you when you arrive on the scene. We'll give you information on what bystanders or family or other people that are there, law enforcement or otherwise, and what they tell you. And this is specifically not what the patient is telling you. This is what other people are telling you before or during your interaction with the patient. We'll work through our standard assessment sequence with your initial contact. Is that patient alert and talking to you? And then a quick check for is there critical bleeding or injury. In some cases there would be. In other cases, like a guy having chest pain sitting in his house where there's no trauma, there wouldn't be. But we want you to always put that step in there. Critical bleeding must be dealt with immediately. We'll have you do CVO where you check on circulation, ventilation, and oxygenation using our standard format. Then you'll move past your critical decision point into gathering data and info. And these are things that you estimated in your initial contact, and now you're going to put numbers to them. You're going to actually measure them. You can get these in any order, although we certainly like pulse ox early on. It gives you 2 bits of information, both heart rate and oxygen saturation. And then we'll help you learn to report your findings in a standard way. We'll help you gather information on the history of present illness, the HPI, and ask the when, where, why, and how questions, and then appropriately fill in answers to the sample OPQRST questions. We're not going to ask all of those in every case, but we want to remember them all and consider them all in every case. We'll frequently talk about past history and meds, and remind you to get a list of medicines or bag up the medicine bottles if there is no list, rather than writing all those down. And while those may not mean much to you at early on in your career, as you start to gain more experience, they will, and certainly they matter to the paramedics. We'll help you remember to ask about cardiac issues, respiratory issues, does the patient have diabetes, hypertension, and other factors that link into this. Also part of your gathering data and info is a rapid trauma exam where appropriate, or more focused and detailed exams as appropriate. Then we work a lot on handoff to the ambulance, what that sounds like, what order you put things in, and then your inbound patient report. So even in cases where you're playing first responder BLS role, we want you to still practice those inbound reports. It's an acquired skill, requires some repetition and some coaching, and we want those reports to be short and concise and have pertinent things talked about early on and emphasized. And we want vitals given in a standard order as opposed to the order that you may have acquired them. We always want them reported in this order. We'll also talk about a handoff to the ER. Again, even if you're a BLS first responder, we want you to practice that ER handoff. Again, it is an acquired skill. And so the handoff to the ER sounds very much like your handoff to the ambulance crew when you're in the BLS first response role. We want to practice those as well. And then we want to help you learn to debrief. This is how you gain capability from each experience. And we want you to maximize your ability to gain capabilities from every experience. There are things you can learn on any given call that you can use on future calls that are not identical, but are similar. We want you to be able to transfer that learning. And these are the things we want you to go over. What went well? What would we change if we ran the very same call next time? What do you think was going on with that patient? And so even though you may not be officially diagnosing, you certainly want to think in that order. And then what things do you need to learn or prepare for to get a little bit better before your next call? We also want to do written reports. Written reports, again, very much like verbal reports, are an acquired skill. They need some practice. And it gives you another chance to review that call. And so again, the written report can be a learning experience if you'll approach it like that. We want you to write your reports in chronological order. We want you to use good spelling and grammar. If you're going to use medical terms, they need to be appropriate as well as spelled correctly. We want you to write your reports in the first person past tense, and that the patient told me or I assessed. And that's the proper way to write a written report. And then finally, we will help you with your kind of in quotes video debrief. So in the paramedic program, we actually do video of our scenarios and of our simulation cases. And our students go through that video and actually watch a video as they're doing this part of the debrief. And so you can do that with any call. And while you don't have a physical video, you do have an idea as you kind of replay events in your head of what went on the call and what you can learn. And so we want you to look at that from a standpoint of how did I do? Was I professional? Was I able to communicate clearly? How did the team respond to me? And some of those sorts of things. So this can be a very valuable learning experience as we go through these cases. And this is the standard format that we'll use for them.